Hi viewer, now we are going to listen on audio as a part of Oet listening practice. Based on that audio, some questions they have asked below. So for that we are going to answer. So kindly listen carefully what the audio speaks about. Actually this audio is related to handover between two healthcare workers. So we have to find who is that and what is the purpose and the content of the audio we have to listen carefully and we have to answer it. Now I am going to play. Kindly listen carefully.
Moving on to Mrs. Emily Douglas, who had a right total hip replacement yesterday and was due to start her post-op physiotherapy this morning.
So she said, what I understood is she said she's talking about Mrs. One patient. What patient? Patient name she said.
A right total hip replacement yesterday.
Yeah, one patient they undergone total hip replacement surgery.
Was due to start her post-op physiotherapy this morning.
So she wanted to start physiotherapy. So from this line I understood who is giving the handover. So handover is given by physiotherapist. So I am writing here physiotherapist. Physiotherapist. Okay. Then another question is, what is the purpose of the handover? So for that we have to.
I postponed the first contact with us as she was in a lot of pain after the surgery and didn't get much sleep at all. Another thing I should mention is that Mrs. Douglas is deaf and...
So before that there was one line. There is one line. It says she is due to physiotherapy. So here we can from that line we can understand what is the purpose of handover. For purpose of handover is about okay, some more line we can hear.
Needs to lip read to understand you. Waking up after the operation was very disorienting for her, so I thought it best to wait until this afternoon before we started her post-op exercise program.
So exercise program, she said exercise program. So the purpose of the handover is exercise program for the post-operative patient. Post-op patient. Next, the third question is complete the notes about the handover by adding in text after the 4 headings. There are 4 headings given. One is surgery, second one is post-operative information on the patient, special needs, physiotherapy to start. So surgery is total hip replacement surgery. Post-operative information on the patient is post-operative exercise. Then special needs, here she said the patient is deaf, so we have to maintain the lip readings. Lip readings we have to maintain to make the patient to understand what we are telling or what we are giving instruction. What is our instruction? To share to the patient, we have to maintain our lip reading. We have to show to the patient that clear our lips. Yeah, because then only the patient see our lips and what we are telling, that the patient can understand. So once again I am playing this audio.
And didn't get much sleep at all. Another thing I should mention is that Mrs. Douglas is deaf and
here she mentioned Douglas is deaf
needs to lip read.
Needs to lip reads. So that is a very important, that is a special need of the patient. One is deaf and lip reads. Then another fourth is physiotherapy to start. So when physiotherapy to start? For that we have to hear further audio line.
Understand you. Waking up after the operation was very disorienting for her, so I thought it best to wait until this afternoon before we started her post-op exercise program. The nurses took down her PCA at midday and she started taking oral analgesia now. If you check with her nurse, you can find out when her next painkillers are due and time her first exercise instruction after that. And remember to face her when giving instructions so she can lip read properly.
So the physiotherapist started after giving painkillers. So there is some words he said after due for painkiller. We have to confirm with the nurse, then we have to start the exercise. So I am writing here after painkiller. Due. Okay, now we are going to check the answer. So first one is a physiotherapist. Okay, it's correct. And second one is exercise program for the patient for, okay, for post-op patient I have written, but here to provide information about a patient who has just, okay, this is the purpose of handover, not the purpose of talking with the patient. But the question is, so for that we have to understand the question properly, otherwise the answer will be wrong. What is the purpose of the handover? To provide information about a patient who has just had a hip replacement and needs to start physiotherapy. So this is the main purpose for the handover. So my answer was wrong. So second answer was wrong. So now I am correcting it. So third one is answer, actual answer is, so right, I didn't write the right total hip replacement. Post-operative information on the patient is exercise I have written, but here pain, not much sleep, that is the post-operative information. So there are also mistake. So post-operative information on the patient. So post-operatively the patient was having pain and felt sleeping problem. So that is actual answer. So we made mistake. So now corrected. Next is special needs is deaf lip reads. Special needs deaf and lip reads, that I think written perfectly. Then physiotherapy, fourth point is physiotherapy. For that answer is post-op exercise instructions. So I have written physiotherapy to start. Okay, what means what I understood it, when physiotherapy has to start. So that's why I written after painkiller due. But we have to understand that physiotherapy, what is the physiotherapy? That is post-op exercise instruction. Physiotherapy related word is post-op exercise instruction. So that also mistake. So now I corrected all the mistakes. So how much we are correctly writing, that much our that is our grasping power has improved. That it means, okay, how much correctly we are writing, it means our English grasping power or the fluency in English uh, is increased. So here I think mine is little not very good. That's why little more mistakes we found here. And if you go to next page, so what they asked here, it's continuation. This page is continuation of that audio. Here they asked one question: what does the colleagues have to do this afternoon? So this is the question. Regarding this question, three answers also given. Give first option is give the patient painkillers before she exercises. So like that there is no conversation I had from that audio. Okay, another option is start the patient's exercises after painkillers are given. I think this is correct. So after painkillers, the exercise instruction the nurse has to give to the patient. And third option is wait until the patient recovers before exercise instruction. Wait until the patient recovers before exercise instruction. So like wait until the patient recovers, that is not the part of the conversation as far as I understood. So I think the B is correct answer. Regarding this question and answer, some questions they asked here. One is look at the context of the question. In this, what is the context of this question? In it means which environment this question is happening. Next one is what is the focus of question, and third one is look at the option. What key terms are common to all three options, and fourth one, what are the action words in each options. So these are the four questions they asked from this question and this answer options. So we have to write about this. So context is the healthcare professional talking about post-operative patients. So this is the context situation. So that is the answer for the first question. So already I have written this answer here. And second one is what is the focus of the question? The question focuses on what the colleagues has to do for the patient. So this is the focus. His colleagues what, because handover is giving. So the colleagues what she or he has to do for the patient. So that's what another physiotherapist is telling to his colleague. That is the handover is happening there. Then third question, look at this option. These options, there are three options. In these three options, what key terms are common to all three options? Here you can see key option is first and first option is exercise. Here exercise is common. Here also exercise is common. Here also exercise is common. And here patient is there. Here patient is there. Here patient is there. So this patient and exercises are common in these all three options. So that we have written here. Then fourth one is what are the action words in each option? Action words like verbs. Here give, this is action word, give the patient painkiller. Here start and here wait. So these are the action words. Here these are the action words here given here. So I have written here. So this is what this is about this question and options type of questions. So then another one is next page. This is third page of this audio related, this audio, the same audio given here too. Here audio once again we can, if we want we can hear once again the same audio. Here in the third page also they have given, and here one more question also they have given. What does the colleague have to do this afternoon? One question is there. Okay, the same question in previous page, what question and answer options was there that they have given. So I already said B is the correct one according to me, as far as I listened the audio. So now I am going to check the answer. Is this right? Check answer. Yes, this is right. Tick. You can see that tick mark. Okay, so it means it is correct. So this is the based on this audio, some question and answers we worked out. Thanks guys. We will meet in our next video. Bye.